According to a medical dictionary, genetic engineering is the science of making modifications to the genes of a plant or animal that introduces a result into an organism in order to change one or more of its characteristics. In 1990, the Human Genome Project was launched. This 15-year project eventually sequenced all 3.2 billion letters of the human genome. For humans, this could be a positive step because mankind is now able to develop the traits and behaviors that remove and prevent disease. Genetic engineering permits citizens to become better athletes, parents will be able to create designer babies, and society will limit the number of people who become ill with cancer. 23andMe is a website that allows you to send your DNA and discover your family history. Using science and research, 23andMe has discovered many people's family line, introduced people to relatives they did not know, and found interesting heritage characteristics.
Genetics.
Right.
It hasn't happened yet, but it's beginning to. It's going to completely change medicine and how we practice medicine. Because we'll be able to know from a genetic standpoint what the best therapy is for each patient rather than guessing as we do now. And as well as being able to offer individualized preventative care based on genetics. I think that's probably the biggest. I mean, you have things like the MRI and the CAT scan, and all the different techniques that pathology has. Surgery by robots. There's been a lot in the last 15 years, a lot more during that time period than probably the 30 years before that.
Whether you have been diagnosed with cancer or just checking up on your health, diagnostic imaging is able to detect and diagnose diseases at its earliest, most treatable stages. The medical dictionary states that diagnostic imaging is the use of high-energy modalities such as X-rays, ultrasounds, magnetic resonance, and tomography to allow the visualization of body tissues. Nationwide, the fraction of imaging procedures that were advanced increased from 9.3% in 1991 to 18.8% in 2004. For example, using a CT scan to detect the first signs of cancer instead of a cardiac catheterization, medical technology not only improves the lives of individuals, but lowers healthcare costs as well. The National Bureau of Economic Research has found through studies that the increase of medical imaging is directly tied to an increase in life expectancy for Americans. Over the past 20 years, manufacturers have introduced new products and system innovations that have reduced the radiation dose for many procedures up to 75%.
Personally, I would say the invention of the electric cautery pencil. It's called the Bovie pencil for slang, I guess. It's this electronic machine. You put a patch on the patient so you can complete the electrical circuit, and it's used for stopping bleeding. You literally cauterize the blood vessels to keep them from losing it. I think the benefits from that are certainly speed and efficiency. No longer do you have to take a piece of silk and go down there and tie the knot. You can just zap it and go. It's become standard for every single case, whether that be from my time in the operating rooms, whether that be from just an open surgery or laparoscopic using the cameras and everything. It's always there. I actually say in the last 20 years, laparoscopic surgery has probably become the most beneficial technique, I think, for treating everything from ovarian cysts to gallbladder removals, appendectomies. You can do a procedure that's called a Nissen fundoplication. It's to help prevent acid reflux. You can do that all just by poking 3 holes in somebody's stomach and manipulating instruments. So I know with those cases, at least, recovery time is hugely advanced and sped up because there's just 3 small incisions.
Laparoscopic surgery is a minimally invasive surgical technique through which cameras and instruments are used to see inside the body with minimal trauma to the patient. Most laparoscopic incisions of the skin are around 1 inch, whereas the traditional open surgical case is around 10 to 15 inches. In the last 20 years, laparoscopic surgery has become the standard technique for removal of inflamed appendix and gallbladders. In fact, it is estimated that over 1 million gallbladder removals are performed annually in the U.S. The greatest contributor to the widespread application of laparoscopic surgery is the advancement of video technology. Greatly enhanced light sources, improved camera quality, and simple technological functionality now enables skilled surgeons to complete a complex procedure in shorter time and with minimal side effects for the patient. In fact, since laparoscopic surgery is so minimally invasive, many patients can go home the same day as their surgery took place. Hospitals all over the world utilize this technique, and it continues to make a difference in the lives of many people. Nanotechnology is the future of medicine. While technological advances to medical machines has been a trend over the past 20 years, medical research is now turning towards new treatments on the nanoscale level. Better understanding of the cell and its functions has led to revolutionary ways in which doctors can detect, observe, and target diseases. Currently, nanocrystals can be injected into a human being and attached to specific disease cells based on their chemical makeup. Once attached, the nanocrystals fluoresce, enabling physicians to observe, pinpoint locations of the disease cells, and target them with specialized medications also composed of nanocrystals. This allows for the effective treatments and enables the localization of the medication, resulting in fewer side effects to the patient. Nanotechnology is now providing its utility and effective use in both the diagnostic and treatment phases of patient care. According to the U.S. National Institute of Health, nanomedicine research funding is expected to increase dramatically in the next decade with the establishment of 4 nanomedicine research centers scattered all across the country.